So in this section, we'll be talking about the different sorts of tics, the difference between motor tics and vocal, also known as phonic tics. We'll talk about what makes a tic a simple tic versus a complex tic, and then talk about the clinical course, what usually happens to children with tic disorders. The first, most basic sort of tic is what's called a simple motor tic. These are tics that involve usually a single muscle group and are non-purposeful. The most common of these is something like an eye blinking tic. It's a forceful eye blinking sort of movement. You can have facial grimacing, shoulder shrug, mouth opening, and it doesn't have to involve just the head and extremities. It can also involve something like the abdomen, which is a very interesting sort of tic, which I see occasionally. But this is involving a very simple movement in a single muscle group, a non-purposeful sort of movement. Now, when motor tics become complex, that's where the movements take on more of a behavioral, looks like a habit, more of a complex sort of activity. A very common one is something like a little bite on the collar, maybe a pull on the shirt, some sort of unusual move, tapping sequence, unusual movement of the legs while they're walking. Other things like lip licking, and things that look more like habits. And these are things that can be confused with something like OCD or behaviors, and we'll talk about a little bit the subtleties between the two and making a differentiation between those. The second real broad category of tics are vocal or phonic tics. These are what I'll say to children or families as noises. Again, they're simple phonic tics and complex phonic tics. A simple phonic tic, much like a motor tic, is something that's nonsensical, non-purposeful. It sounds something like a squeak, click, grunt, throat clearing, coughing, even animal noises. That's a common one. And then usually in children with more severe tic disorders are complex motor tics, or complex vocal tics, although these are the ones that very frequently appear in the media, and these can be utterances that are intelligible, phrases, counting, and then coprolalia, which is the utterance of vulgarities, which although being very rare, is very commonly portrayed in the media. Now, tics tend to come in bouts or have a fractal sort of quality to them, and that's where the frequency and pattern of tics within short period of time, say hours, is very similar to when you step back and look at the frequency of tics occurring over months or years. For example, within a year, there may be several months where the tics are bad. Within those several months, there's a few weeks. Within those weeks, there's a few days. Within those days, there's a few hours. And even within those hours, there's a few minutes. So tics tend to come in bouts, these little episodes of tics, and it's a pattern that when you look at it close up in a day, having a few minutes that are bad. When you step back, you can look at a few weeks or months that were bad, even within a year. So that's what we call the fractal sort of quality to tics. Now, there's a general evolution to tics, and earlier I mentioned that the most common sort of tic is an eye blinking tic, and that's important because it illustrates something here, and that is that the most common sort of tics tend to be midline or occurring more in the center of a person's body. They tend to be more rostral or towards the head rather than more distal in extremities, and that simple tics tend to precede complex tics. Therefore, the most common sort of tic would be something like an eye blinking tic. This also helps me in the office. When a family comes in and they say, you know, my child, I'm concerned that he has tics, he has this very unusual sort of tapping behavior that he does, or he has a shirt pull, or he does some sort of unusual movement with his leg. At that point, I'm thinking, I wonder if this is more of a habit or a tic. So sometimes what I'll do is go back in the history, and I'll ask something like, have they ever had any sort of simple tics? And they'll go, oh yeah, you know, back 6 months ago, they had an eye blinking tic, or they had this unusual throat clearing, which we thought was just sinusitis or some sort of sore throat. And so then in retrospect, I'm putting together a little bit of a history that makes the current complex motor tics involving distal parts of the body to be more likely a tic rather than something like a habit or behavior. Now, importantly about tics, although phonic or vocal tics are are perceived as being more severe, and in some ways they are because they tend to be more disruptive. There's not very good predictive value to which one's going to come first, a motor or a vocal tic. And so a child who comes in that has a throat-clearing grunt or squeak, some sort of noise tic that parents are very concerned about, this doesn't necessarily portend a worse outcome compared to a child who comes in with a simple motor tic. So families will often ask, well, what's going to happen to my child with tics? Is this going to be worse? Is this going to turn into Tourette syndrome, or even does he have Tourette syndrome? And we'll talk about that in the next section. Well, tics usually come on somewhere between 6 and 7 years old, and this is important. One reason it's important is that if I have a child that's brought in at, say, 3 or 4 years old, and the parents have noted some sort of unusual movements, it makes it a little bit less likely that those are tics. It might make me think of doing some other sort of treatments or consider some other diagnoses. And likewise, for older kids, say teenagers who start with an unusual movement or behavior, it'd be unusual for that teenager to have tic onset, say, after 9 or 10 years old. The tics tend to wax and wane. That's an important characteristic of tics, usually associated with some sort of stressor or anxiety or stuff going on at school. And then a statistic which I quote to families quite often is that a lot of people outgrow their tics by puberty, maybe as many as 70%, and then 85% of children will have their tics resolved by adulthood. The last little part of this section, I want to talk about something called a premonitory urge, or the feeling that people get right before their tics come on. This is something interesting for me that I'll often ask children about in the office is, what does it feel like right before your tic happens? Do you feel it coming? Most children, 80 to 90% of children, will report at least occasionally having this premonitory urge or the feeling of the tic coming on. They'll often describe it as an itch, something feeling tight and needing to be stretched, and then the release is the tic movement. Now, this is important when it comes to something called habit reversal training, which we'll talk about a little bit later, that only about a third of people will have a premonitory urge, or that sensation of the tic coming on before every tic. In the next section, we'll talk a little bit about Tourette's disorder. It's an interesting diagnosis with a lot of emotionality attached to it, which hopefully I'll clear up some confusion.